Hi, welcome to our Facebook Live. Today we're talking about COVID-19. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. I'm pleased to be joined by Dr. Betty Chu. She is the Associate Chief Clinical Officer and Chief Quality Officer for Henry Ford Health System. And Dr. Chu also is the Incident Commander for our health system's response and preparations for this public health emergency. Dr. Chu, welcome.
Great, thank you. Thank you for having me, Dave.
A couple housekeeping items, folks, for those who are watching. We ask that for those at home, please be sure to turn on your sound. Also, make sure to read our disclaimer, which is pinned at the top of this thread. In addition to that, we have a patient hotline that is set up. You are welcome to call that hotline at 313-874-1055. That is Monday through Friday, 8 a.m. to 5 p.m. And also visit our website, henryford.com/coronavirus for the latest updates. Dr. Chu, you've been at this now for a while, for several weeks. Sure. How are things going?
I feel very good in terms of our level of preparedness. I think it's been a hard time because the situation's completely evolving. As everybody knows in the state, what you're hearing in the media, the same is happening, of course, within our organization. We're trying to respond to all the new information that's coming out from the governor and the federal government, also respond to a lot of concerns we're hearing about in the community. So overall, I feel very comfortable with our level of preparedness. With that said, I don't think you can prepare enough for what's coming. So we are every day getting up and making sure that we're doing the best we can to be ready for our patients and our community.
What concerns you the most about this situation?
I think the uncertainty of knowing the volume of patients we're going to be seeing is very challenging in this situation. Additionally, because of the nature of the virus and how it can spread so rapidly, the impact on our employees really probably has me keeping up at night the most right now. We've found that it's been challenging. As I said the other night, patients don't come in with a COVID sign on them, so it's hard for us to know and identify those patients, and that impacts our employees, and it adds to a lot of the things that we need to plan for when we're managing our patients and our employees.
We know by experience that healthcare workers are pretty resilient folks, right? Talk a little bit about how the team's responding in this situation.
Yeah, I agree. I think there's no doubt that healthcare workers come to work every day. They're resilient, they're committed, they're compassionate. I will say this situation has certainly brought up a lot of anxiety amongst our teams. It's anxiety that we try to manage with as clear as communication as we can. But at the end of the day, healthcare workers are also your neighbors and they're members of the community. So they're subject to all the information that you're hearing as well, in addition to the fact that they have to get up every day and come in and do their jobs in an environment that's uncertain right now. So I would say they're resilient, but naturally they're going to have a little bit of anxiety as well too.
There are a number of safety measures in place across all of our hospitals, as well as those nationally and internationally. Can you talk about what those protections entail?
Sure. The safety measures that we think about for us, a lot of them are really focused on trying to protect our workforce. There are some statistics that say that we may lose 40% of our workforce, and that the rate of infection among healthcare workers is higher in than the general population. That's not surprising given the chance that they may be potentially exposed. So we're implementing a lot of safety precautions. Some of that is why it's hard for the community to get into our facilities, why we've had to adopt strict visitor restriction policies. And that's really intended to help protect not only the patients that are in our buildings, but also our healthcare workers from being in contact with somebody who's not aware that they might be sick. So we are currently employing a very strict visitor policy, restriction policy. We're also, and we'll talk a little bit more later, about canceling elective surgeries and procedures, or what we call non-time sensitive procedures to help, again, decrease the amount of interaction that our workers will have with the population, but also decrease the likelihood that our patients might bring in something into our facilities that could cause problems for us.
That's a good segue into the next question. Can you talk about some of those surgeries and those procedures that are impacted now?
Yeah. So we've taken an approach as a health system, like many other health systems, of really taking a look at what are the critical urgent things that must be done in the next few weeks during this crisis, and what are those things that we could probably put off safely for our patients for a few weeks. That process takes a lot of detailed analysis of what's considered a time-sensitive and what is considered a not time-sensitive procedure. For instance, I brought this up the other day. If you had back pain and you were scheduled for back surgery in 4 days from now, you would probably feel pretty strongly that that is an urgent surgery to have done. One of the challenges with that is we know that bringing a patient into our facility puts them at risk. But additionally, if that patient was exposed to the virus at home and wasn't aware and wasn't symptomatic, there's a small potential chance that they could bring that virus into the facility. Additionally, we're really trying to make sure that our teams can focus on managing the surge of patients that we anticipate with COVID. And as a result of that, reduction in the non-time-sensitive procedures allows us to consolidate our supplies, our resources, and our biggest resource being our people that we have.
Until recently, folks who would come to the hospital basically kind of walk in and move about, right, to their appointments or visiting loved ones. How has that changed now?
Yeah, it's changed significantly, as many of you probably know if you've tried to get into our healthcare facilities, as a result not only of the governor's ruling, but also prior to that, many of us had started to restrict visitors from coming into our facilities. So we have a strict visitor restriction policy. We really are trying to avoid any non-essential visitors to our facilities. We do have exceptions to that based on certain circumstances. Certainly you can understand there are needs that we have where you need to have a visitor in with you during the facility. If you're a minor, there's other exceptions to that. But really we're trying to minimize the amount of visitors. We've also gone to ensuring that people like our volunteer workforce, our vendors that come into our facilities, we have a lot of vendors that come in and out, that they stay safe by asking them to suspend their activities as well too, so that we can minimize, again, the spread and the risk of COVID.
This week, Henry Ford started testing.
Yep.
What's that process like and who's affected?
Sure. Well, I appreciate you asking about that. There's been a lot of questions that I've been receiving over the past few weeks about testing. It's been a real hot topic in the news. We have been really fortunate that we have just a world-class laboratory service department here led by Dr. Zarbo. And one of the things they started working on weeks ago was developing the ability to have in-house testing at our facility. So that in-house testing process, and I think I was mentioning this before, is sort of like, if you have a plant that makes F-150 trucks and then you decide that all of a sudden you're going to make Ford Tauruses, you have to really reconfigure everything, not necessarily in the entire lab, because this is just one test that the lab is running, but you do have to reconfigure the processes involved with doing that lab. And then you also have to make sure there's quality control, that when you do the lab, there is a high level of sensitivity and specificity to that test so that the result that you give the patient and the doctor is the correct result. So that process takes time to get that done, and it does require an FDA approval process. And as you can imagine, every lab around the country is trying very actively right now to try to do the very same thing. Everybody's trying to move in that same direction. One of the big challenges we have is the supplies, the swabs that we do to do the testing are limited in supply. And so while our lab is doing a tremendous job in terms of running tests, we are making sure that we're utilizing those tests in certain types of patient populations that are at the highest risk and the highest priority right now.
The equipment that healthcare workers wear, Dr. Chu, there are shortages out there, as we know. How is Henry Ford managing that situation?
Yeah, so one of the roles you mentioned as incident commander is to lead a team of people, a huge team of people that's really focused on everything from human resource related issues to operational related issues to clinically related issues with the outbreak. And then every hospital, which we call them operating units, or also our clinics, operating units, have also an incident command structure. And during that process, supply chain is integrated in all of that, because we want to always continually do an assessment of how many supplies, how many materials, how many masks, how many face shields do we have as an organization to help protect our employees. So we've been doing an incident command structure for a while, but even prior to that, supply chain had been doing very active inventory control and management of all of our supplies so that we can try to ride out the storm that we're going to need to have this personal protection equipment, or PPE, to help protect our employees.
Before we get into some specifics about COVID-19, just a reminder to folks watching that we have a patient hotline now set up at 313-874-1055 from 8 a.m. to 5 p.m., Monday through Friday. We also direct you for the latest updates to our website, henryford.com/coronavirus. Dr. Shu, let's talk about the virus itself. How is it spread, and how do we contain it?
Yeah, so as many people know, it's an airborne droplet, and the reason we have this 6 feet distance is that the spread of the virus, when you cough, when you sneeze, through that airborne mechanism, the droplets eventually will fall to the ground, and so they're less transmissible. We do know that now the virus can live on hard surfaces, and so one of the things that we've learned, again, as the virus is evolving in our understanding of the virus, is that it can live on surfaces for maybe anywhere from 2 to 9 days. So we're starting to understand a little bit about the mode of transmission. There is some discussion on whether, if the virus is on a surface, how contagious is it actually? So you can have a virus detected, but it may not necessarily be something that's contagious if you touch it. Again, I caution the public that it is a brand new virus. So we're trying to figure out a lot about the virus right now. So if you're hearing conflicting information, part of it too is that we're just trying to figure out some aspects of transmission and contagion related to the virus as well.
What's the importance of social distancing?
Sure. That is a critical piece of our efforts to contain this public health threat. It is so important that people, anybody listening on this, really take to heed the warnings around social distancing. And that's because this is a very contagious virus. And so we know that in order for us to decrease the number of people that are infected, by keeping people away from each other, allowing them to stay in their homes, and allowing those people with the virus to convalesce in their homes, will allow the virus to clear, but will decrease the total amount of the surge of the patients in the population. That surge is what we're going to have a really hard time as a healthcare system in general, all healthcare systems handling. And so that flattening the curve that many people have seen on social media, that shows the large curve that would happen if we didn't have social distancing versus what could happen if we do have social distancing, is really, really important, because we want to be able to handle the patients that we that have COVID within the healthcare system. We know we can manage those patients. The challenge is going to be if we have to manage a very large volume of patients. So that social distancing is a critical message that we hope everybody hears.
We have a question from our audience from Bryn. Can my kid play outside with the neighbors safely?
Oh, that's a great question. You know, I have 2 children myself, so I've been thinking about this one as well, as they want to go ride their bikes. They've got a little free time right now. My instinct would be to tell you, which I think is very, very reasonable, that I would let my child go out and play with the neighbor's child as long as that other child is not sick. Especially if it's outside, I think that's fine, because that, of course, helps if they keep a healthy distance from each other. I think that would be even better. So if you can keep them 6 feet apart from each other when they're playing together, but I don't think it's unreasonable for them to go on a bike ride together and get some exercise. And we all know that our kids are getting pretty cooped up, and we're getting pretty cooped up with them, so I don't think that's a bad idea.
There's been a lot of misinformation on the internet, on social media throughout this pandemic. What's the biggest myth that you've seen?
Yeah, I think the myth that we're overreacting is something that is concerning. I think the confusing messaging that we're receiving is probably adding to that myth that we're overreacting. I would love focus on a million other things, I'm sure, like many of you would right now. But we feel pretty strongly that the evidence suggests from China and South Korea and Italy and many other countries that we cannot prepare enough at this point. And so if we're overreacting, I would be, I just clearly say that overreacting is probably the biggest myth.
One of the messages could be, though, right, Dr. Chu, would be to listen to your doctor.
Absolutely. Yeah, absolutely. I think that's helpful to get advice from your physician. We know that, and Dave, you know, we've set up a MyCare advice line as well, too, that we can get nursing advice, and we have virtual visits from physicians that people can have access to those virtual visits as well. But getting advice from your doctor around your specific concerns or questions is really important, especially if you're starting to develop symptoms and trying to understand how to manage your symptoms, given your personal risk factors and your personal history.
Could we step back for a second, back to the testing topic, sure, and sort of clarify who can get these tests and who cannot right now?
Yeah.
Because there's been a lot of discussion out there in the community,
yeah,
about, you know, who can take these and who cannot.
Yeah, I think the challenge is that in a perfect world, we would offer the entire population a COVID test because we would want to know from a public health perspective who has the disease, where does the disease live, and what's the prevalence of the disease in the population, and what's the actual mortality or death rate related to the disease, so we can best advise the public. Unfortunately, because of limitation in testing, because of limitation in supplies, we currently right now in all health systems are trying to prioritize the sickest patients, the patients that are coming through our emergency departments, the patients that are inpatients at hospitals. So for those patients who have mild symptoms, who are concerned that they might have COVID, we ask that you stay home, that you convalesce, that you do what you would normally do to kind of recover from the flu, which is drink lots of fluids and rest because it is a virus. And if you need to seek counsel, to call your doctor's office first before you come in to seek counsel. But we are prioritizing that testing for right now our sickest patients. We have started, as you know, some drive-through sites. But even at those drive-through sites, there will be screening questions asked and there's a process to determine whether or not you qualify for a test in those drive-through sites based on the criteria that we're starting to identify, based on symptoms.
We know the symptoms of COVID and the flu are similar. Can you distinguish between the two?
Yeah. We used to have more clear guidance on that. I will say it's challenging because there is co-infection. People can have flu and COVID. So, you know, like most things, I think if you go online and you type in, I have these symptoms, it's pretty hard to tell exactly, do I have flu or do I have COVID at this point? There was some discussion early on that maybe there is a difference in cough or sniffles or fever, but right now I would advise the public the best thing to do is to call your physician and ask questions related to your own personal symptoms because, again, those types of things are changing a little bit too.
This is a question from Gabrielle. Is this virus airborne?
Yes, it is. It is airborne, and that is one of our concerns. Why we're ensuring to try to protect not only ourselves with personal protective equipment. We're in hospitals taking care of COVID patients, but it is an airborne virus. It has a limited distance because the droplets of which the virus is contained in will eventually fall to the ground. So the question about whether it can go long distances, that makes it airborne, I would say right now that 6 feet is what we're thinking about, but those droplets do travel somewhat.
To our audience members, please be mindful they're having sort of a lag time with issues with our connection, and we're very sorry that this is occurring. Please hang in there with us. And we're getting a lot of questions from you folks, so please keep them coming, and we'll do our best to address them as fast as we can. Thank you. This is a question from Heather, Dr. Chu, asking about chemotherapy patients and whether they're and their caregivers and bringing them for their appointments. How is that being handled on the clinic side?
Yeah, so our Henry Ford Cancer Institute has come up with specific guidelines for patients who are cancer patients currently receiving treatment and are receiving infusion therapy. Those specific guidelines, again, internally are available to our staff online. Those questions that we're getting a lot, though, are if I'm pregnant, if I'm a patient with chemotherapy, or today I got a text from a patient that was, I'm supposed to bring my mom for a mammogram tomorrow. I'm supposed to go get a mammogram myself tomorrow, and I'm at home with my mother who's on chemotherapy. Should I go to my mammogram appointment? I did advise her. I said, you know, it's an elective mammogram. It doesn't need to be done. We talked a little bit about the fact that we're trying to limit elective procedures. And I mentioned to her that if she has the ability to come a little bit later. Now, I want to say that with caution because I would encourage you, just like she did, she reached out to her doctor and she asked that question specifically so that I knew her story and I knew that it was okay for me to advise her to wait a little bit based on her history. But yeah, there are special considerations for people who are immunosuppressed, who have chronic diseases, that are pregnant, that we want to take into consideration.
We've been hearing a lot about the importance of hand washing.
Yeah.
What are 3 or 4 different things that people really need to be doing constantly throughout this pandemic to keep themselves safe?
Yeah, I think to your point, hand washing is critical. As you know, there's been a lot of different behaviors that we're all adopting, whether it's bumping elbows or staying a distance away from each other. So that social distancing that we're hearing, which I think is going to be the new buzzword for 2020, is social distancing. There's a lot of conversation about those types of behaviors that we should be doing. Additionally, the use of hand sanitizer, of course, if you don't have access to a sink with soap, that's critically important. But it's really some of those basic behaviors. Another thing I would really stress is if you think you're sick or you think you might be coming down with something, please stay home and stay away from the general public. That's a really critical, important thing that we want to encourage people to do.
We see a lot of folks wearing masks out there in public, in the community, airports, etc. Talk about the mask issue. We know there's a shortage on masks for healthcare workers. How is that playing into the supply chain?
Yeah, I really appreciate you bringing this up. We certainly understand that there's a lot of anxiety in the population related to this issue, and we just talked about how it's airborne, so I can certainly understand human nature wanting to put a mask on. The challenge with wearing a mask is we know that masks are most effective for the source. So if you have COVID or if you have the flu, wearing a mask is effective to prevent transmission. There's not really good evidence to say that the general public wearing masks is going to help them catching the flu, or catching, I should say, COVID in this particular case. And so what it does do, though, is it creates a lot of usage for masks. And those masks are masks that we are struggling to maintain in all of our health systems, not necessarily in ours currently right now, but we're struggling to keep up with the mask consumption usage in the general public. And we have a pressing need in the next coming weeks to make sure that we have an adequate supply of masks in our healthcare facilities to help take care of those patients so that our workers can stay healthy. So I would encourage people, unless you are personally sick yourself, that wearing a mask in general in public is not as beneficial as you might think it is.
Can you talk a little bit about the symptoms of COVID, what they are, and specifically how they may differ from the flu or other infections?
Yeah, so one of the things that we talked about earlier related to the difference between COVID and the flu, and that's again a common question that we get, is there's some overlapping symptoms and the symptoms are changing. So for instance, there has been some discussion, and again, I'm not saying that diarrhea is a clear symptom of COVID, but there's been some discussion of COVID being found in stool samples in 50% of the patients who had COVID in China. So there's a lot of discussion about, are there some additional symptoms outside of the traditional fever and new cough that we think about? We also could be finding some other symptoms, the runny nose, those types of things. So what I would advise the public right now is the symptoms are actually quite overlapping. We're in we've had a very prolonged flu season. We've talked about this before. Before this conversation started a week ago with COVID, where we started seeing cases in Michigan, we were testing 2,500, 3,000 flu patients in our system alone, and about 45% of them were positive for influenza A. So we're in a prolonged flu season, as well as we have COVID to manage. So the symptoms will likely be overlapping, and we are finding patients that are testing positive for both flu and COVID at the same time. And the treatment's really the same at this point.
Which is?
The treatment's really, again, because it's a virus, there is no antibiotics that you're going to take for the treatment. It's really just conservative approach, which is manage the symptoms, symptom management at home. Whether that's, your runny nose, your cough, your fever, manage it at home. There's certainly some discussion about using antiretrovirals, but again, not considered standard treatment for COVID at this time. So really, it's just symptom management for treating the symptoms of the virus.
Based on some of the information we've been seeing up to this point, a large percentage of the population seems to recover fine from this.
Absolutely.
What groups then are most vulnerable?
Yeah, so that's a really important point. Large percentage of the populations, again, similar to the flu, will recover from the virus. The vulnerable populations that we think about are those patients that are over 65. There's some discussion if they are saying over 60 now or over 65. There's some other vulnerable populations you talked about before. The immunocompromised, patients that are pregnant are considered more vulnerable. So want to be people with chronic diseases also may be more vulnerable.
Transplant patients would fit into that category, Dr. Chu?
We have a large transplant population in our health system, and definitely transplant population.
It's a question from Amy. What precautions should we be taking in getting necessities from the grocery store?
Okay. Well, if you can find the toilet paper, which has been a fascinating thing, Amy, I guess I would say if the question is what precautions should I be taking when I go to the grocery store, is that the question, do you think?
Yes.
Okay. I would say many of the grocery stores now, as I'm sure you're well aware, the lines and the lines that we're seeing at Costco and those other places have sort of died down because there isn't as much volume in those stores. I think the tenets of social distancing, trying to keep your space around people, I think are really critical, important. Obviously, hand washing, avoiding touching your face, your hands, your eyes, your nose, your mouth. And then when you get home, do a good hand washing as well, again, when you get home. I think those are the critical things when you're going out to the store. Certainly, we all have to go to the store. We all have to get some goods
right.
Because we can't go to the restaurants anymore. So,
You've been working long hours, as have a lot of people.
yes.
In your downtime, what's that like?
It's been pretty busy lately. So prior to a week ago, like most people, I try to get some exercise, and I spend time with my kids. I've got a wonderful husband. I've got 2 kids and 2 cats and a dog. So, I clean a lot of litter boxes every day. So I do the things I think that most people do in their downtime. I love to read. I love to watch movies, but try to get outside a little bit. So, yeah.
As a reminder for folks watching, we have a patient hotline. You can call that number at 313-874-1055. That's Monday through Friday. Also, go visit henryford.com/coronavirus for our latest updates. This is a question from Amber. It has to do with mental health services. Dr. Chu, how are these services impacted? And what precautions are being taken place at those facilities?
Yeah, that's a great question. Thank you, Amber, for asking that. We have an inpatient mental health facility called Kingswood. We also have Maple Grove, which is a voluntary center for mental health admissions. And so, and we also have inpatient behavioral health units on some of our hospitals. The behavioral health community provides a unique risk, especially on the inpatient side, because in many of the units, the patients are gathered together in common rooms, and that's part of their therapy. And so some of the unique challenges that we have in the mental health space, I guess, on the inpatient setting is just based on the way that they're organized. Certainly, you wouldn't want somebody with severe depression to just stay in their room all the time, because part of the therapy is to be part of group therapy. So we're really thinking through how do we help keep our staff safe? How do we keep those cohorts of patients safe? We're also looking at what services can we discontinue, or I should say the word suspend, I think would be a better word, suspend for the time to help keep and minimize the volume of patients that are coming through some of those facilities. And we're looking at other strategies just to make sure that we can handle if those patients have COVID and they have behavioral health issues, because they'll need some special care.
What if I become exposed to COVID, and what should I do? That's probably the most frequent question that we're hearing. Yeah. What should they do if they think they've been exposed?
Yeah. So if you don't have symptoms, or you do have symptoms?
Let's take if you don't have symptoms at this point, and then we'll transition to if you do.
So if somebody's been exposed and they don't have symptoms, what I would suggest that you do is call your physician, or you could call one of our hotlines. They can give you some advice on how to direct you if you don't have a personal physician or somebody that you can call, and they can direct you. And what I would say is your likelihood of getting COVID by a contact with somebody who has COVID depends on how long you've been around that person, how close you've been to that person. So that usual assessment is some of the questions that they'll ask you. So if I happen to be walking by someone in the airport and they were a COVID patient, but for 2 seconds I walk by them, the likelihood of catching COVID is very small. Okay. If I was sitting next to them in a movie theater this close for 2 hours at a movie, or 3 hours during a movie, and they were coughing all over me, then my likelihood of catching COVID is higher. So if you're not symptomatic, and it depends on the scenario of which that you were exposed to, so that's why it's a little bit tricky to say everybody is going to be at risk of COVID if there was somebody at the airport who had COVID. Part of the process in public health and epidemiology is really tracing who actually had a significant amount of contact to that COVID patient, and then would be at a higher risk for actually contracting the disease. The other part of your question, which is if I've been around a COVID patient and I'm symptomatic, unfortunately you're seeing that because we have spouses of COVID patients and kids of COVID patients that have been very sustained in contact with those COVID patients who are developing symptoms. Our advice to them is to stay at home and call your physician and call your provider to find out what are your next steps. If your spouse has been diagnosed with COVID already through a testing swab or some other mechanism, we can pretty much assume that you there's a high likelihood that your symptoms are due to COVID. So the need for additional testing, and we talked about testing earlier, is much lower in those patients because the likelihood that you have COVID, and that we wouldn't tell you anything differently, which is stay home, convalesce, do better, is no different than if we had told you to run into a clinic and get tested. So in that particular case, if you have symptoms, we'd just advise you the same thing, which is stay home, call your provider, and find out what your next step should be.
Another option to stay connected with your provider is through video visits, Dr. Chu. Yep. How do those work?
Yeah, so we're really happy that we've had that capacity for a long time in the health system to have video visits, but it's certainly become really apparent in this crisis that video visits are a key aspect of helping deal with public concern, anxiety, and the need to see providers. The way a video visit works in our system is that you can either access it two ways. One, if you are an existing Henry Ford Health System patient, you can access it through your MyChart app and request a video visit. If you are not an existing Henry Ford Health System patient, you can call the MyCare advice line, and the nurses that will answer the phone are able to set you up with a medical record number, so then you can access the video visits. They also may simply be able to answer your question without you needing a video visit, because it may not be something that a provider is required to see. We've been very actively working, and I want to give a lot of credit to the team that's been working on that, to increase the number of nurses manning the hotlines and the MyCare advice line, and to increase the number of physicians that can handle those video visits, because there's been such a demand for our video visits.
As a reminder, that hotline is 313-874-1055. You can call our phone agents between 8 a.m. and 5 p.m. Monday through Friday. Dr. Chu, let's now turn to the difference between isolation and quarantine. What's the difference between the two?
Sure. Well, quarantine is often the term that we'll use to say if we have, again, the exposure that we talked about earlier, where we might have a patient who has a potential risk, or either a high risk of, usually a high risk of exposure, and we will quarantine that patient. So for instance, many health systems have developed policies where if an employee is exposed to a COVID patient in a high-risk situation, that we will quarantine them at home for 2 weeks or furlough them for 2 weeks. That policy has been evolving for a lot of health systems because you can imagine very quickly you will lose a lot of your workforce if you're furloughing everybody for 2 weeks if they've been in a high-risk situation. So we're continually assessing that policy internally in our system. Isolation refers to a very standard set of rules related to the management of a patient once they're inside a healthcare facility. We use a specialized room, and that room has negative pressure, so that prevents infection and contagion from leaving the room. And we use specialized equipment that we talked about earlier, which is personal protection equipment that we train our employees to go in and out of the rooms in a safe manner. And so isolation refers to that room process that we use to call the rooms a specific category of room.
Should patients have any sort of anxiety about the healthcare workers that are treating them when they're in their healthcare PPE equipment, Dr. Chu?
Yeah, that's a great question. No, they shouldn't, for the following reasons. When a healthcare worker is exposed to a patient with COVID, they are required to remove that equipment and then put on new equipment if they're going to see another patient. So if your mask is soiled and wet, we're required to take it off. So we have processes for ensuring that the PPE that your team member is wearing is safe for the next patient.
This is a question from Myrna. Can you be infected after you recover from COVID?
Yeah, that's a great question. And I was reading some recent information about that. There's, of course, a lot of papers and research that are coming out of this crisis. And because China's had the most experience, there is a conversation of if there are a couple of patients that have been reinfected with COVID, which kind of calls the question on whether or not there's immunity related to having an infection. Generally, it's felt that there is some immunity offered if you do get the virus. As we know, it's a novel virus, so nobody's had the virus right now, which is why it's been very problematic. There have been some case reports, however, of people who tested COVID positive, cleared the disease, and they got retested again, but that is I would say that's a rare exception and not usually the rule.
And there's no evidence that a flu shot can protect you against COVID. That's correct.
Right? They're different types of viruses. Yep.
If I do test positive, what's that time period that I'm required to either stay quarantined or self-isolate?
Currently, we're recommending 14 days, and I say that, and not being an infectious disease specialist, again, the fact that this is an evolving situation, but that's the current recommendation.
If I touch anything that, my desk at work, I'm at the grocery store, and I'm touching things or any kind of store out there, do we have any evidence of how long COVID lives on these hard surfaces?
Yeah, so earlier I mentioned we think it's anywhere from 2 to 9 days, depending on the kind of surface. And this is relatively new, again, information. Again, the virus has been around, I think, maybe 3 months or so, 2 to 3 months. And so the discussion of how long does the virus live on a surface, but as I mentioned earlier, if something lives on a surface, it doesn't necessarily mean it's live active virus that's on the surface, or it could mean it's live active virus. So I think the science behind that question that you're asking is not entirely clear at this point, except to say some of the newer evidence would suggest that it definitely does live on surfaces.
It's a question from Pat. Should I use urgent care or the emergency department?
We would ask that you would call ahead, and I'm sure every health system around the state and country would tell you that same thing. We would ask that you would call ahead because that would allow them the opportunity to triage you prior to having you step into the facility. You're also seeing a lot of tents. We have some tents that are going up outside of our emergency departments to help us triage patients. And the intent of that, and we appreciate everybody's patience, is to really help make sure that we keep the patients and the care providers that are inside of those departments departments, whether they're urgent cares or whether they're emergency departments, we keep those folks safe, and then we allow, in some areas, again, those triage processes to occur of those patients outside, especially if they haven't called in ahead of time, because we know that can't always happen.
For the pregnant moms out there, any special advice for them, Dr. Chu?
Yeah, and again, as an obstetrician, pregnancy offers a time where we're a little bit more susceptible to diseases. So as I mentioned earlier, because you're a little bit more susceptible to diseases during pregnancy, the precautions that we talked about with social distancing, with avoiding travel. Again, there's a reason for the travel restrictions. I know we're getting close to spring break plans, and I've been asked that from some of my friends. Should we go on spring break to Central America? There's not an endemic there. I would just encourage folks at this point, there is a reason we're asking folks not to travel, because we don't know the true prevalence of COVID right now. We don't know exactly where it's spread because there is not enough testing. So right now, one of the things I would definitely say to pregnant women is to be very cautious about things like travel plans and, again, exposure to a lot of outside pathogens.
What about breastfeeding?
Data's, again, still evolving on breastfeeding right now. Generally, the recommendations are to avoid, if you have COVID, to avoid breastfeeding. So I just want to be clear about that. I don't know the exact number on the number of pregnant COVID patients that are breastfeeding in the country or in Italy or in South Korea. I haven't had a chance to look at that myself. But I would generally say, as a rule of thumb, if somebody has COVID and they're breastfeeding, they would likely want to discontinue that activity.
This is a question from Janae. How can Henry Ford non-essential staff support our COVID efforts?
Wow, that question warms my heart, and I don't know, Janae, if you work for us, but thank you if you do. We've had such an outpouring of support from the community. We have had folks reach out to us and ask how they can help. We are looking at all of our staff and looking at redeployment opportunities. So, for instance, in my department, we have some quality abstractors and some care experience folks that are now taking temperatures at the front door to screen visitors as they come through. We have folks that are answering the hotline now who normally wouldn't be deployed in that manner. So there is opportunities too for non-clinical staff for us to use them. Had a non-clinical team member who went and helped set up a tent over at Henry Ford Hospital. So if there are Henry Ford employees that are listening in and you're interested in helping out, and feel free to email me directly. I'm happy to direct you to the right person for that. Nina Ramsey, our Senior Vice President for Human Resources, is actually consolidating and developing lists of individuals who could be redeployed to other areas. And we really do appreciate that question. That's a wonderful question for us to hear.
You mentioned the flattening the curve concept earlier. Can you explain what that means?
Sure. So that graphic that maybe many of you are probably familiar with online that shows the number of patients with disease, and it shows that dotted line that shows the capacity of hospitals and the healthcare systems to be able to handle a volume of patients. There is one graphic of it that's a very large ski slope, a very tall ski slope, that shows that if we didn't do anything, and we allowed the disease just to do its thing, and we didn't do social distancing, and we didn't stay away from each other, and we didn't close the schools, and we didn't close the bars, the disease, because it's so infectious and contagious, would rapidly spread. We'd get a large amount of people in the population that would get it, and it would probably overwhelm our healthcare system. So you're seeing that, I'd say, in Italy, where they were kind of late coming up with some of the things that we are now implementing in our state. If we were able to put those things in place, which we have in the state, it would flatten the curve, which would allow, the virus is still around. It's not going to mean the virus is going to go away. It would allow the time that the virus is in the population to not be so big of a hill, so big of a surge, and it would allow the healthcare systems, the ICU beds, the ventilators, for us to be able to support those very sick out of the people that are getting sick in the population, so that the percentage of the very sick over time is smaller and allows us to help manage that surge of patients.
If a family member is tested positive and is self-isolating at home, what do you recommend for other family members in that home to stay safe?
Yeah, the biggest thing is for the person who has COVID to wear a mask, and to wear a mask all the time around their family. If the mask gets soiled, then to change that mask, or if the mask gets wet from perspiration or moisture. It's helpful for you to have social distancing from your other family members while you're in the in your home, which sometimes is challenging depending on the size of your home. There's some discussion about if there could be transmission to animals. So I saw recently a recommendation for you to keep a distance from your animals as well too, which is always hard to do because they're coming to you mostly. So that is another recommendation. It is not recommended that the other family members need to wear masks if the source is wearing a mask. So to be clear, if the source is wearing a mask and they're keeping a distance from other family members in the home, then every family member does not need to wear a mask in the home, unless of course they start to develop symptoms, at which point that they would want to prevent coughing on other people in the home.
How has family life been for your family? The kids are at home, right?
Yeah.
What's that like?
Yeah, so just like everybody else, my kids are in the public schools, and I got that text, I think at 11 o'clock at night saying tomorrow no school. So there was a bit of panic at the house on how to get backpacks and how to figure out what to do with kids. Our kids happen to run right into spring break, so they have a 4-week break. Definitely a 4-week break right now. So, fortunately my kids are teenagers, so they're pretty happy still connecting with their friends, and that's one observation I have, and you may have had, is even though we're doing social, isolation, everybody is still connected because my kids are still FaceTiming each other or Insta-chatting each other. I don't know, again, I know that's not correct, but they're still connecting with each other online. So. But yeah, we're doing okay at home, and I've got them doing a lot of chores at home right now, so that's good.
Question from Julie: can some carriers of COVID never develop symptoms?
Yeah, that's a great question. Yeah, again, as we talk about COVID and we say that there's some people that will get very sick, the same is true on the other end of the curve. There are some people that would be tested positive for COVID that were asymptomatic at the time. And so in other countries where, like in South Korea, where they're doing mass screening, you're able to capture those patients because they're testing a lot of patients with their testing. Here, as I mentioned, I'd stress again, we are not recommending that people who are concerned that they might have COVID, no symptoms, come in, because we do not want to test those patients currently. We're really focusing on patients who have symptoms, moderate to severe symptoms, and those patients that need to be hospitalized or in our emergency departments, and our own healthcare workers. We're making sure that we test them. So I would say it is certainly possible that you could have COVID and not have symptoms.
Is there anything special that Henry Ford is doing to check illness of its own employees before they come to work? Sure,
yeah. So starting, I'm forgetting what day it is today. Is it Wednesday today?
Wednesday.
It's Wednesday today. Starting a few days ago, that's how crazy it's been. Starting a few days ago, we recommended screening for all of our employees. And that screening does have to encompass symptoms for all of our employees. And we have a lot of facilities, so that has been challenging. We are limiting the number of entrances that folks are coming into our facilities, which is challenging because, again, that creates bottlenecks, but it's important so that we can manage the number of employees that are coming in and they can be screened. And then, like many other health facilities, some hospitals are also doing temperature checking of their employees as well as they come into those facilities. But primarily, we're doing symptom screening for our employees, every employee that's coming into our facility. So it's been a disruption, I'll be honest, to do that, but it's a really important aspect of, again, us maintaining a safe workforce and a safe environment.
We know one of the biggest concerns on our end, Dr. Chu, is the border crossing.
Yes.
We have about 950 healthcare workers that work for Henry Ford who live in Canada. Yeah. How is that situation being evaluated on a day-to-day basis?
Yeah, and it is being evaluated every single day because it will have such a deep impact on our workforce, especially at Henry Ford Hospital in Detroit, where many of these employees are coming across the border. We have a lot of Canadian nurses. We have also team members at our Macomb facility that are crossing the Blue Water Bridge as well. We have folks in home care. We have case managers we have folks in my department that are Canadian. So it would be very challenging if the border is closed. One of the things that we're talking about is during the Ebola crisis, there was a strategy that was set up where there were shuttles on the Canadian side that would screen our employees' temperature before they got on the shuttle and then bring them across the border to a centralized location for drop-off. So we're relooking at that strategy right now if the border were to close, and we would have a hard time. There's been a tremendous amount. I want to congratulate our team for staying in close contact with the authorities to make sure that we know the current situation on what's happening with the border.
Question came in from Harry. He says, my last chemo for pancreatic cancer was November 2017. I am really healthy and doing well now. Should I still be careful?
Well, I would say everybody should be careful. I'm guessing, Harry, that you're thinking specifically if you are more immunosuppressed based on your cancer. That's a tough question for me to answer, especially in this format, because I don't know enough about all of your medical history, your age, your demographics, where you're from. So I'll be honest on that particular question. I would refer that one to your physician or your healthcare provider for that particular question.
As the incident commander for Henry Ford's response to this pandemic, what keeps you up at night?
Making sure our employees are safe. That probably keeps me up the most. I have no doubt in my mind that our employees will be able to manage illness. That is, the patients that are coming in that are sick. They will be very stressed if we get a huge surge of patients, but I worry about our own employees being able to stay healthy mentally and physically in order to care for the patients. We have some people that are working exceptionally hard. I'll give a shout out to the Department of Infectious Diseases at every hospital. They in particular, as you know, David, are working very, very hard to field questions and manage concerns, especially in an evolving crisis like this. People are really looking for content expertise, and they've really provided that for us.
It's a question from Kristen. Would you put staff on the floor to help with PPE when we are ruling out COVID patients?
So, say that one more time. Would I put staff?
Would we put staff on a floor to help with PPE if we had ruled out patients?
You mean to help? So I'm not 100% sure what you're asking, but I think I know. So when you say to help with PPE, do you mean to help with donning PPE or putting the PPE on? And I go, you're reading a question, so right. I know it's hard for you to answer that question. What we do if we have a patient on the floor with COVID is, and of course prior to that, well prior to that, our practitioners have been trained in donning and doffing PPE. And I would remind too that, we do this all the time. We have infectious diseases all the time that come through healthcare facilities. So our healthcare providers have to be trained on how to put PPE on, irrespective of it's COVID or flu or SARS or Ebola or anything else. They have had that training, and we have infection control, infection prevention team members that go around educating and making sure that people are properly using the PPE equipment.
And to that point, should patients be afraid to come in any medical facility right now?
I don't think afraid is the right word. If you need to come into a medical facility because you have an illness that requires treatment in a medical facility, you should still feel comfortable coming into a medical facility. We are putting all of these processes in place to try to ensure that we can keep a COVID patient, again, we talked about negative pressure rooms. So we are putting many, many processes to think about how do we, in our own facilities, manage that patient population so that we don't infect our own employees and we don't infect other patients that are in facilities. So I think patients can be very comfortable that is what we get up every day and we work on. What I will say, and again, I'd emphasize it again, is if you don't need to come to a healthcare facility right now, we'd encourage you not to, because it is a time of stress for the community. It's a time of stress for our healthcare workers. And if you do need to come, please let us know ahead of time, especially if you're coming in with flu-like symptoms or symptoms that we talked about before, with a fever, a cough, a new cough. If you're coming in with those symptoms in particular. By the way, our EMS teams, our ambulance teams have been fabulous partners for us. They're all well trained because we know that not every patient comes in a car. Sometimes they come in an ambulance. So the EMS providers around the state have been also doing a lot of training. But again, those teams are used to picking up patients who could potentially have an infection. So they're used to using those types of practices and protocols.
It's a question from Julie. Do we know the incubation period after exposure?
That is a really good technical question, and I had a question, an idea that was going to come up. I'm going to defer that question, and certainly, Julie, we can put that on our frequently asked question section, because I want to make sure I give the right information, and because the content knowledge around COVID is changing so much, I don't want to misstate it and provide you any, any wrong information. But we can put that on the frequently asked questions.
And this one from Kelly, how long will you test positive after getting it?
Yeah, that's another question that is really up in the air a little bit right now. So, we were talking the other day with my infection control team that if somebody's exposed, it could have a 5-day incubation period, so that if you sat close to somebody with COVID and for a prolonged period of time, if I tested you that day, you probably would be negative, or you may be negative because you haven't had enough of an incubation period for us to test you to be positive. So we do need to wait a few days to test a patient who has had an exposure risk, because again, those tests don't immediately turn positive, and it sort of speaks to your question about incubation period.
Dr. Chu, we're coming up on the end of our discussion here. Anything that you'd like to add that we haven't talked about up to this point? I would just say there's been a lot of anxiety and stress in the community related to this particular issue. I know we're going to get through it. We spend a lot of time together, Dave, these days, trying to communicate to the public and reassure the public. It is a challenging time, but I would just advise you to try to look into your own life and see what are the kinds of things that you can do during this time of slowdown. And just stay focused on, the next 24 hours. Maybe it's the next week, it's the next couple of weeks. But spring in Michigan's coming, so I look forward to getting outside and doing some gardening with spring coming. And there are some things we can certainly do at our homes. Now's a good time to do your spring cleaning because you're at your house. So I would say use the opportunity to do what you need to do. And the nice thing about everybody taking a pause is that there's a lot of people that can't get to you right now because they're not working as well too. So it's a good time to really focus and prioritize on what's important in your life. So I'd encourage everybody to do that. And make sure to wash your hands.
Absolutely, absolutely.
We want to thank everybody watching for your questions. And if you have any further updates, we can view this web chat later on today. Just go to henryford.com/coronavirus. And that concludes our broadcast. Thanks very much. And Dr. Chu, thank you very much for your insight.
Thanks, Dave. Appreciate it.